My name is Frank. I'm the founder and CEO of TPP. It's absolutely great to be here in Indonesia, Bali. What a beautiful place. And I think it's a fantastic opportunity for us to get together and talk about the future of hospital systems. I was particularly impressed at the start with the Health Minister's speech. It's not often you hear a speech like that. As a computer programmer, it really spoke to my heart. And I think if any country looks like they're likely to do something, I've never seen anything thought out so well. For example, for me, about it being patient-centric, patients owning the nodes. And the fact that interfaces are going to be mandatory. Yeah, it's never been a better time to develop IT healthcare from a tech point of view. The opportunities here across the Asian Pacific region are phenomenal. And that's why I think it's important, because every day you hear about some new tech company or some new product. And I think it's really good that we've got something like HIMSS to actually try and define what's being delivered so that the customer knows, so that the hospital knows, or what can be done by a hospital with this product. What's it capable of doing? So I think that's fantastic, but I'd like to talk, just to delve into a couple of areas which are dear to my heart. And I'm thinking here about the doctors and nurses, the users of the system. I'm thinking about the patients, what outcomes they get, and I'm thinking about governments. And how do we build our systems for those three groups of people? And how can we know what the future is? So the three things I want to talk about are safety and mistakes. I think this is key, especially in a medical system. It's easier for us all to make mistakes, and I think systems need to have more things inbuilt to help those doctors and nurses. I mean, for example, I just flew in yesterday from the UK. I think my first flight was about 6 hours. I got to Qatar, about a 2-hour layover, and then about an 8.5-hour flight. When I woke up this morning, I didn't know what day it was. I was a bit jet lagged. I woke up about 1 o'clock this morning. I think I was still back on British time, or I might be, I don't know what time I'm on. But we expect doctors and nurses during the middle of the night to record early warning scores, to do addition. When their blood sugar is at a low, and guess what? They make mistakes. In a hospital we were recently looking at, about 10% of all the early warning scores were mistakes. And that was just simple addition, just adding up, 6 numbers, 7, 9, 11, 3 and 5. But it's the sort of thing that you will get wrong. And I think that's the sort of very simple, straightforward thing we need to help our doctors and nurses with. To give them confidence, take the burden away from them. Just as the minister said, my second point here is built-in interoperability. We mention it in HIMSS, but we need to go a lot further. How do the hospital systems communicate with each other? How do they communicate with primary care? And how do they communicate right out up to government? Which leads me to my third point, national EMRs. And if we get our hospital systems right, if we get the patient-centric systems right, just as the minister said, I feel like I'm repeating his speech, we can start looking at the benefits of the national EMR. So I'm going to start with some personal history. I started computer programming when I was about 14 years old. I was at school. We didn't have a computer. We had to write down on pieces of paper what we thought the programs were. And then the teacher had to pretend to be a computer and would tell us what a computer would have done if we had a computer. I loved it. It was like doing a jigsaw. I was absolutely fascinated by it. You can imagine how more excited I was when I actually met a real computer. I got into the local university. I didn't actually go to the university, I just sneaked in, and I managed to attend it for about a year, going into the computer department, about the age of 14 or 15. And I absolutely loved programming. And I felt I could see that this could make tasks easier. At that time, my parents had a business. They employed about 15 people. They'd been going for about, 15, 20 years. And they were very busy with the administration. They were always worried about making mistakes, so everything had to be checked twice or 3 times. Doing the payroll, calculating the pay to date, percentage tax, calculating the VAT. And they were just very, very worried about making mistakes, and it took a long time. I wrote a computer system for them. It absolutely transformed their lives. What used to take a day, day and a half, was transformed into a 10-minute task. They got time back and they didn't make any more mistakes. A lot of the stress went out of it. They actually started going out for a meal together once a week, which was unheard of. I felt slightly uncomfortable about it, but it seemed that they were very happy together. They became very wealthy as a result of this computer program. So I realized early on the power of what IT can do. Then I worked for a bank, and it was the early days of PCs. And again, I just saw IT revolutionizing the customer experience for the bank. The bank was making less mistakes because the computers, well, once you've got them right, they don't make the mistakes, they just stupidly repeat the same thing over and over again. The bank made more profit, staff were less stressed, the customers were happier. And then I switched into healthcare about 25 years ago. And I felt I really wanted to join it all up. And I wanted to bring that power of IT and that joined up nature, because nowhere is it more important than the patient record, to revolutionize healthcare. And what I've seen in my time, and these are just examples that I've seen personally, community nurses using IT to plan their routes around the city and getting back 30% more time. 30% more time to spend with the patients. And this is coming from the nurses. They used to have a waiting list for their service. It disappeared. And they're happy and less stressed. We're about to do something exciting in the UK where we're going to automatically file the normal pathology results for GPs. We're about to give back half an hour to every single GP right across the UK. That's a fantastic number to be able to achieve, and only IT can do this. And very recently, just by linking primary and secondary care, pre-op assessment, so before you go to an operation, you have to have an assessment. Normally takes about 45 minutes. We can bring that down to 5 minutes just by joining up the systems. And if you think about it, computers, 25 years ago were just about powerful enough to run a small clinic, maybe 5 or 6 doctors, 3 nurses, 5 or 6 admin staff. And we could kind of do that. I don't think people have actually fully realized the power of what you can do with it now. We are now seeing computers running right across countries, one single EMR. You don't have to have a computer just for one hospital. You can have a computer for 20 hospitals or 100 hospitals or 1,000 hospitals. And that would give us pause to think about how we design our IT healthcare across our countries. Systems that can run in every single clinic, every hospital, and connected to the patients. So if we build a system like that, with high standards, with the safety built in, what do we get if we build it? And what do we get if we don't build it? Well, I want to talk about some experiences that I've had of where it's not there, where it's not joined up, where you don't have I'll reference the minister there, that mandatory interoperability. About 27 years ago, my dad was suffering from a terminal condition with his lungs, and he had his last heart attack, and he was supposed to not be resuscitated. Unfortunately, because they didn't have his medical record, they resuscitated and put him on a ventilator. At the time, in the moment when it happened, I was delighted. And I thought, well, Dad needs to stop working now. This is the last time. But I had no idea of the consequences of this fairly straightforward error. It meant that we, the family, had to choose to switch off my own father. It was a terrible moment. I remember sitting awake all night with my mum the night before and telling my mum that it was all right to do it and it was the right move. And whilst I was in agony, much worse for her. Much later in life, my mother, when she was frail and elderly, went into hospital. She broke her hip. And they got her on-admission drugs wrong. They didn't transfer from primary care, with the result that we actually put her onto end-of-life care. So my sister had a chat with one of the doctors and said what her primary care drugs were. Once she was given them, within about 6 hours, she was fine, back eating. We took her off end-of-life care. And then, a rather surprising one, our local hospital has managed to take out my sister Maria's appendix 3 times. 3 times, not twice, 3 times. I think it's quite an achievement. All of these errors are not, the doctors are acting on the information in front of them. They're doing their best. In my experience of working with doctors for 25 years and nurses, they're fantastic people. They want the best for the patient. They're trying. They feel vocational about their work. They care. But we put the wrong information in front of them, and you're going to get errors, like what happened to my dad, like what happened to my mum, and like what happened to my sister. I am certain that within this room, you have shared experiences like this. Healthcare is personal. And it's so important that we fix that. And IT can help us with that. And what does it look like if we get it right? Very early on, we developed a joined-up system about 25 years ago. And I asked one of the consultants in the ED department, I said, does it help? Are you finding it easier? He said, it's not just easier, it's fantastic. And he told me a story about, it was a young girl, I don't know how old she was, I'm guessing she was about 21. She was trying to commit suicide. So she'd swallowed a bottle of pills that she had in her possession. She'd flushed the container down the toilet, and a friend brought her in unconscious into the ED department. Now, normally what would happen there is the consultant would try to contact the primary care, the GP, have to ring them up. It was during the middle of the night, maybe take them 20 minutes, half an hour for them to get to the surgery. If they can get hold of them, time would pass. In this particular case, the consultant was immediately able to act, could see immediately the primary care record, was able to tell what drugs this young lady had been taking, what pills. And he said to me that that connectivity saved this young lady's life. We were about 6 months in. I've stopped asking about the benefit of it, because it's so obvious the benefit of it. Slightly softer story, again, happens to be from ED. There's an old lady, came in, she didn't have very long to live, she was really, at the end. By accessing her primary care record, they could immediately see who the next of kin were. They contacted her daughter and her son, and they were able to be with their mother when she passed away. All these events are vital to us as communities across the world. And just joining systems together can create that. So where do we get to next? We've got connected EMRs. If we've got primary care connected to secondary care, we're going to make less mistakes. It's going to be a better outcome for doctors. It's quicker for doctors because they can see immediately what the other doctors have done. They don't have to try it again because they can see, well, that didn't work. They're not relying on the patient's memory. But we also get something else. We get big data, and I know you've all been trained in what that means, and that means artificial intelligence. AI is not a new concept. I worked on it 30 years ago. It's just that the computers wouldn't do it. They just weren't powerful enough. Well, my goodness, they've become powerful enough. So I've personally developed AI with my team, for example, to just from the computer reading the patient notes to predict cancer. The first one we did was ovarian cancer. We can now reliably predict about 50% of the time ahead of the GP the need for a CA-125 referral for ovarian cancer. And I think most of you will know that this is a particularly bad cancer, and the sooner you spot it, more chance the lady has of surviving it. We can now do that with a range of cancers. It is an astonishing thing. And if you think about what a doctor has to do in the UK, in their average career, over a 40-year career, they might see 6 ladies with ovarian cancer. They're running about 7 or 8 minute consultations. The chances of them spotting that and getting that right every time, well, it's not a game I would like to play. And I think AI can really assist us with this. And it can assist us in parts of the world where there's not enough doctors, in some of our rural areas, where they don't have direct access to a clinician. We're now at the stage where we can get one endocrinologist. When I met my first endocrinologist, he was looking after about 10,000 patients. With AI, you can look after about 10 million patients. Because the AI can stratify, can predict the risk. And I know you'll hear this from a lot of people, but it's from my personal experience of working on this stuff and doing it. Of course, you need big data, but wow, right here in Indonesia, what a fantastic place. There's no problem. I know from chatting to some of the guys here, you've already got about 80 million people on your app that you use for COVID. What an amazing, fantastic start you have. You can start running your AI right now. Get height and weight in. Start asking people about the exercise they do. What an opportunity. For me, this is important as penicillin. It's another tool in the doctor's bag. Yeah? It's something that will transform you. And I know if you watch the Hollywood movies, of course, AI is always about to replace us. It really isn't like that. If you think about a spelling checker, I remember using a spelling checker about 30 years ago, which checks my spelling when I'm writing an essay. I find it very useful. It's very clever. I don't know how it does it. It seems to know all the words. But I don't go to bed at night thinking, oh dear, the spelling checker is going to replace me. I wonder if the spelling checker is going to take over the world. And it's the same with AI. I think we can relax a little bit about it. I see a lot written about it, but there's no way the AI that I'm writing is going to take over the world. It's just going to help doctors. And each country needs to develop their own AI. I think that's very important for genetic reasons, climate reasons, diet reasons. You kind of get it. And here's what the future is going to look like. I've actually done a lot of work on this. You're going to look at your smartphone. You're going to start talking to your smartphones, telling your smartphone what your symptoms are. It will give an initial diagnosis. It will walk you through the questions that a doctor would ask you. This is going to be invaluable to save our doctors time. I don't believe there's a country in the world that's got too many doctors. As I've gone around the ASEAN and Pacific and region, I haven't been to a country where people have said, oh, Frank, don't worry, we've got too many doctors and nurses. There's no problem here. There is a shortage. And then we can get an initial diagnosis, saving time. And then that person can maybe be redirected to the pharmacy because it's inappropriate for them to visit a doctor, or to be told immediately to go to the emergency department because it's serious. So here we are at HIMSS. What should you be asking your EMR vendor? Big one for me is cost. Yeah? What's the real cost of it? Now, how much do I have to pay up front? Why can't I have a license where I just pay the same amount every year? Why do I have to be committed for 10 years? Do you do software as a service? Are you in the cloud? Can I get out of my contract with you when you don't deliver at any moment? And will you give me the data back? These are all things that I see around the world where people get into these 10-year contracts. They pay the supplier a load of money up front. It doesn't really happen in any other industry. In healthcare tech, we seem to have drunk this poison water to pay, we have in the UK recently, about £500 million for one hospital system. It's absolutely astonishing. And people in organisations wear this as a badge of honour. I've done a £500 million project. If that person worked for me, I'd sack them. What a waste of money. It's too expensive. We're looking from our suppliers for data access and interoperability. Have we got apps and mobile solutions? Do doctors and nurses like using the system? Does it empower them? Does it make it quicker? These are questions we need to be asking when we're looking at new systems. And when I want a change in the system, and I want to just collect one more piece of data, as I'm sure we all did during COVID, how quickly does my supplier respond? Am I allowed to do it myself? Or do I have to wait for them to do it? It's madness if you have to wait for your supplier to do something. It's even more madness if they manage to charge you for it, which I think is an unbelievable feat of business. Can the system that you're buying develop and run AI? And if it can't, it's not a future system. Don't accept it. And will it have knowledge transfer? Will it create a digital health economy? Or will it be all wrapped up in a box and it doesn't change? So, coming to the end now. Relax. So I've said some nice things there. I've said some things that I completely believe, and some of you will be sitting there and saying, well, that's all very well, but how much is it going to cost? I read something that said the value of a digital health economy in the UK, where I'm from, is worth many billions per year. So let's just say as a conservative estimate, we say that it's worth a billion right here in Indonesia, a billion a year to Indonesia, to actually have joined up systems, which allow you to do clinical trials, research, build AI, build the safety and save time right across Indonesia. And let's just say conservatively, that's worth $1 billion. You should be able to bang in an EMR solution right across Indonesia for much less than $100 million. I'm fine if you want to pay more, and a lot of you have done, but I say it's time to stop. In every other industry, tech has brought the cost of the product down. You get more value for money. You see it everywhere, apparently, miraculously, apart from healthcare tech. And stop being hypnotized. They're fooling you. It's cheaper, and it should be faster, and it should be better. So, what do we want for the future? The picture on the left is of my mother. I put these pictures up, and the picture on the right is of my daughter. Healthcare is personal. If we could go back in time to when that photo was taken of my mother and her family. I'd want my mum to get that joined up record. Yeah? The lady taking the photograph is her sister, my Auntie Nancy. She died of ovarian cancer about a year before our particular company started to predict it. I feel that very personally. And I want my daughter to be going to hospitals that will predict her ovarian cancer and will save her. And that's what you want for your daughters and your mothers and your sisters. I think it's a wonderful time to be in tech healthcare. I think the business opportunities are fantastic. But the change that we can make to humanity and to our lives is even more fantastic. I'm looking forward to seeing how you all get on. And after listening to the health minister's speech this morning, I'm particularly delighted to see Indonesia doing it. And I think we should all take sight of that one. Thanks very much.